Well, anyone can attend an STI clinic. There are various reasons for attending. If somebody has symptoms, they would attend, or somebody maybe who has concerns around having history of unprotected sex. If they're looking for advice or information around concerns about their sexuality, or if they've had maybe a history of sexual abuse or rape, they can come in and have a chat to one of the counsellors and be screened if necessary. STIs are most definitely on the increase, and anyone can get them, particularly anyone having unprotected sex, but they can be passed through intimate contact as well. So it would be advised for people who are sexually active to have regular sexual health screens, and this would be seen as a very positive thing. Chlamydia is a bacterial infection, and it is one of the most common bacterial infections that we see in the clinic. It is a very easy infection to pick up, and it is a very easy infection to treat. The problem is that many females actually are unaware that they have the infection. They have no symptoms at all. And if it is left untreated, it can cause serious complications such as pelvic inflammatory infection and can lead to infertility. With male patients, while some of them may have symptoms, they may not be very obvious. And again, if left untreated, it can cause problems with inflammation of the testicles and can also be linked with infertility. Genital warts are the most common viral infection, and they are caused by the human papillomavirus. Most people who are sexually active come in contact at some stage with this wart virus, but only a small number of people will actually develop visible warts. The warts themselves are not serious or dangerous. They are usually fleshy lumps that develop on the genital area, on the vagina, the vulva, the anus, or on the penis, and they can be treated in the clinic with some different lotions or a freezing treatment with liquid nitrogen. There are many different strains of the human papillomavirus, and there are thought to be a small number, probably about 4 or 5, that are linked with changes that may go on to develop cervical cancer. These, however, generally don't develop into visible warts and are picked up on smear tests, and it's therefore very important for females when they reach the age of 25 to have regular smear tests with their GP. Genital herpes is caused by a virus, most commonly the cold sore virus, and the type that we would see more often would be the type that's transmitted through having oral sex. They usually present as small blisters, which are extremely painful and can be treated with a variety of painkillers and antiviral drugs. But the person needs to present as early as possible so that we can help alleviate the symptoms. They very often also are accompanied by flu-like symptoms. Genital herpes is one of the infections that can recur. Sometimes people get recurrences more often than others, and medication can be offered to alleviate these. HIV is the human immunodeficiency virus, and AIDS is acquired immunodeficiency syndrome. We rarely see AIDS now because of the new treatments that's become available, and that's why HIV now is a very treatable infection. HIV is transmitted through direct exchange of bodily fluids with an infected partner through either vaginal, anal, and sometimes oral sex. It can be also transmitted through sharing needles with an infected person, and also from mother to child transmission. As we know, there is no cure at the moment for HIV, but the infection is very treatable, and it's very important for anyone who actually feels that they may have been at risk from HIV to present and test as early as possible, as earlier intervention has been shown to be much more effective.